This is Harvard India Conference. We talk about what India will be going forward. The fact that you chose to call your company Bharat, the fact that you chose to come back at a time when Indian healthcare and biotechnology industry was not where it is right now. The fact that starting a company wasn't so easy in India. And the fact that the STEM industry, the scientific R&D industry in India was not where it was almost 30 years back. What got you here? Because as I said, a conversation with a woman entrepreneur should start with about what it is like to be a woman entrepreneur in India.
This is, in fact, I don't know how to even begin this, but it's this journey for us, for me, because I have to mention to you that all the introduction that was made with all humility, I would have to share it along with my executive chairman, Dr. Suchitra Ella, with whom I traveled this journey for the last 40 years. And it was way back in 1986 that both of us, with our 2-year-old daughter, moved to the United States, and we spent 15 years in college, training and working and raising a young family. I know what it is to be on campus, though it was much different back then as well. And in a cold environment. We lived in Wisconsin, so you can understand what Wisconsin is all about as well. So it's the cold and the snow and everything, the entire ecosystem. The children were young. I was, of course, a working parent when Krishna was in graduate school, and this took 7 years as a PhD student. But I was again a graduate in economics from the Madras University back in India. So that as well, and also my the visa status that I could come to the United States along with Krishna allowed me to work. So my first work permit that I received in this country was in 1987. I can't forget these things. It's so etched in my memory. And I became completely involved as a mother, a spouse, a student's wife, living a life on campus, raising kids. And that moved on. We continued to stay here for almost, like I said earlier, 14 to 15 long years. And then came a turning point, or kind of a thought process in me that I was asking Krishna this question every now and then. What do we do to India? Because we left the country in 86 and it was almost 97, 98 by then. And I said, here we are in the US getting into the system which has received us very well, and we were quite engaged in what we were doing by then, getting into our permanent residency status, and all that things were happening as the flow goes on here. And we were enjoying our work and the environment, the challenges, the opportunities, everything that this entire country, brought forth to us. But I said, Krishna, is this why we came to the United States? Or is there a larger meaning behind this? So I said, I'm ready to go back when you are ready to follow me. So that's how it all began. And he first said, you must be kidding. Are you sure? I said, yes, I'm ready to go. And the kids were young as well, so it was probably the best decision that we took as parents, as professionals. And it was consciously taken. We said, what do we do when we go back? And joining the government was out of question. Joining maybe private industry, private sector, and the life sciences industry was probably not there at that point of time. The pharmaceutical industry was there. But
life sciences industry was in its
given Krishna's background in molecular biology and biochemistry and all those faculties of life sciences, and then working as an NIH fellow under fellowships in medical schools and campuses around the country here. So there was no scope for us to get into jobs, and a paycheck was not guaranteed. I said, let's turn around and become entrepreneurs and do something that we could maybe create for India going ahead into the future, which was not there, and that was vaccines.
What made you name your company Bharat?
Bharat was coined by me because I did all the paperwork. I said my background was in economics, so all that helped. So I used to do all the paperwork, filling all the forms to the banks and the government offices and everything. I mean, everything is paperwork ultimately. Even today, if you still have to type it on your systems. I called it Bharat because I said, in my own thought process, I said, I belong to India. I grew up in India. I took all my initial years of growing up, my education, my children, my parents, the upbringing, the value systems, until college that I was there. I said, I could not think of a better name because I know Bharat stands for many, many, many more things glorious in the past as well. So I said it cannot be called anything else but Bharat. So there was no other name that came across my mind. I did not use my own name or Krishna's name or my children's acronym or some other a modern version of calling it. But I felt that I owe it back to the land that probably had given us the roots and the base and everything that we belong to. Okay. And we were going back to India, so I said, call it Bharat. That's it.
When COVID came and the lessons it taught, the long-term lessons that the Indian life cycle, life sciences and the pharmaceutical industry learned, and we're now really upping the game. And the second aspect, which I'm going to come to, is the tailwinds that this sector now has. And I think that the unique opportunity that exists, and those could be due to geopolitical factors, geoeconomic factors, that really could propel the industry going forward. And before that, I want to come back to as I said, the COVID part. It changed all of us, changed your company. It allowed your company to really give that opportunity to serve not just India, serve the world through India. And I think that was probably the big, I would say, that lasting contribution that your company had in terms of Malapine, because it was not just Indians, right? You're talking about millions of doses to people outside India.
That were also sent out outside of India. Yeah, our pandemic vaccine was not a fluke. I've said this before.
No, research is not a fluke. Research can never be fluke. Yes,
there were many doubts, of course. It's human, and doubts are good to have. But we could only do it, or we were prepared to do it because by then we had slogged in 25 years in India. I was saying this to Gaurie earlier this afternoon. When we moved back to India, India was 50, and we at Bharat were 0. When the pandemic hit us, India was 75. She was 75 and Bharat was 25. So in 25 years of our existence in India, we had allowed ourselves as an organization to build a strong backbone of research and partnerships, collaborations from across the world. And we believed in ensuring that we translate these technology platforms into products and vaccines primarily, so that they get into the public health distribution system. Not only in India, by then we had also graduated to getting accreditations from the WHO, which is our primary accreditation process for any international supply. And we had done all that. And we had, I think, by then done 15 or so other vaccines. Almost everything was, every one of them in the pediatric children's space, but there were also adult vaccines that I mentioned. The typhoid vaccine is one. The rotavirus vaccine was launched in 2015 by the Honorable Prime Minister of India in March of 2015, the first molecule to have been developed in India. From the developing world itself, the first molecule. This, of course, was a very large ecosystem of collaboration with institutions in the United States under the guidance of umbrella of the National Institutes of Health, and so in India under the Department of Biotechnology and the All India Institute of Medical Sciences, and us as the development partner in terms of in bringing out this molecule for rotavirus vaccine, which was not available in India. And the children that we were losing at that point of time was close to about 200,000 infants in India were dying each year due to severe acute diarrhea, dehydration, and mortality. So the world numbers were different. It was close to 700,000 children at that point of time. So this entire exercise of developing a molecule from scratch, the strains were in a -70 freezer at the All India Institute of Medical Sciences. I can't help but remember Dr. Maharaj Kishan Ban, who had isolated the strains from it was an Indian strain from a child who was inflicted with rotavirus infection at the AIMS. So this development process brought us very close to how to understand viral vaccines and viral platform technologies that could be deployed. And the ViroCell platform technology that we had worked on in this particular model, and several other viral vaccines. So by then we had almost like, we were catering to bacterial vaccines, we were catering to viral vaccines, we were catering to recombinant vaccine platform technologies that had been developed by us. So we were very confident that this was also an area that we felt that we should attempt. The first initial thought process was, oh yeah, it's a new virus that has shown up. What do we do? Do we run away from it, or do we just, what do we do about it as a responsible, scientifically driven organization and a research-based organization? So we felt we were compelled to face the pandemic in the manner in which I think we believed that we could, with the resources that were with us at that point of time. And we said, let us try. When we were announced that there was a lockdown in March of 2020, we said we will dive down and see if we could use a whole cell inactivated vaccine platform technology. Instead of going the recombinant route, we as a company, as an organization, preferred to go the classical route, and that is how our Covaxin was completely built on.
As we wrap this up, I think there are 3 points that must be sort of said to sort of wrap this up. One is that India's healthcare expenditure, it was sub 1.5% of GDP about 10 years back. It's now over 2.5% of GDP. That itself tells you the amount of expenditure that is going in healthcare. Not all of it is going in terms of only revenue, but a lot of it is also going for capital expenditure for R&D. Second, the fact that there is a clear intent to set up AI centers of excellence. At some point of time, I think AI's journey is going to probably see its fastest application in sectors like healthcare. And the third thing I would say is that the one thing that the Indian entrepreneurs have now learned is that this cycle of creating an ecosystem which ease of doing business has pretty much now been completed, allowing entrepreneurs to really spread their wings. If these three factors come together, I think that is going to be the future of the pharmaceutical sector, the life sciences sector.